Now, as countries around the world count the cost of the coronavirus pandemic in human lives and economic damage, there is increased pressure on governments to ease some of the restrictions in place. In the UK, the government is warning that the country is still not past the peak of the coronavirus emergency and that the number of deaths is expected to increase further this week before they may start to plateau. We will have updates from the UK in a moment, but first of all, let's go to the United States, where the number of coronavirus deaths in the state of New York has risen to more than 10,000. That's almost half of all the deaths so far across the country. Well, this is the latest from New York's Governor, Andrew Cuomo.
There is going to be no morning where the headline says, "Hallelujah, it's over." That's not going to happen. But, yes, I think you can say the worst is over, because the worst here are people dying. That's the worst. The worst doesn't get any bad than this worst. And this worst is people die. That's the worst.
New York's governor there, Andrew Cuomo, giving a briefing update. Watching that briefing has been Anthony Zerka, who joins us live from Washington. And Andrew Cuomo, so many come to him and listen to his daily briefings. He's very straight talking when it comes to the situation in New York State.
Yes, and I think he was trying to strike a balance there by saying that it does look like the number of fatalities in New York State and in New York City itself has peaked and has started to go down. Same with the number of hospitalizations. But the reality is that people are still dying, and a peak does not mean an end to the deaths, end to the serious medical conditions. It just means they're going to start to decline. And then attention is going to have to turn on how to start to reopen some of these businesses and how to readjust, keeping in mind that if you do it too quickly, you could see another peak at some point down the line. That part of the reason why things have been plateauing in New York and across the country is because of the steps being taken.
And Anthony, we've been hearing previously of how states have been competing against each other when it comes to buying things like PPE. Now, at the moment, a number of states on the West Coast have come together in some sort of agreement. Tell us a little bit more about that.
Right, it was something that was just announced by Jay Inslee, the governor of Washington, that he is going to be working with California and Oregon, these West Coast states, in order to not only agree on purchasing PPEs and ventilators and things like that, but also how and when to reopen their business as well, how to ease back on these shelter-in-place restrictions that keep people from leaving their homes and close all non-essential businesses. You actually heard that from Andrew Cuomo as well, working with East Coast states. And I think that's one of the interesting things about the way the United States has responded to this crisis, is that governors, the heads of the local individual states, have been by and large taking a lead on closing down businesses, taking steps to address the spread of the virus, and they also are planning on taking a lead in when to reopen businesses. On the other hand, you do hear from Donald Trump and the federal government. Donald Trump says it's the federal government's power to say when businesses are going to reopen, when businesses can get back to normal across the United States. And he's forming his own commission with his daughter Ivanka Trump and others on it that is going to be proposing ways to do that too. So it's almost as if there are competing voices right now on how to do that.
For those who are frustrated by the extended lockdowns across the world, even a hint of a path back to some kind of normal life would be something to celebrate. However, the World Health Organization has today issued this warning on the lifting of restrictions too soon.
We know that in some countries, cases are doubling every 3 to 4 days. However, while COVID-19 accelerates very fast, it decelerates much more slowly. In other words, the way down is much slower than the way up.
Yeah, so a stark reminder there from the WHO. The British government says that the UK is still going through the peak of its crisis. The official death toll rose by more than 700 people today. So this now takes the overall figure to more than 11,000 in the UK. And if you have a look at these graphs, these show the growth in number of daily deaths. And you can see that the UK's curve is on a similar track to Italy's. Well, here's the UK's government chief scientific advisor on this.
We're tracking behind Italy. We're following the same sort of path. What do I expect to see happen?
I think this week's difficult. I think this week we're going to see a further increase. Thereafter, we should see a plateau as the effects of the social distancing come through. That plateau may last for some time and then begin to decrease.
So that's from the daily briefing that we have in the UK. It is worth remembering that the UK had, in fact, more time to prepare than Italy's government. Italy recorded its 50th death on the 22nd of February. The UK reached that same point on March the 3rd, so 10 days later. Now, some experts and also journalists are starting to question what the UK could have done differently. Well, here's one exchange from today's briefing.
If you look at some of the countries that acted much sooner than the UK, South Korea in particular, only had a fraction of the deaths that we've seen in the UK. Isn't it clear that had we acted sooner, days or even weeks earlier than we did, that it would have made a difference in terms of lives lost?
I don't think it is clear. I don't think those comparisons are like for like because of where we are on the curve, as Sir Patrick has mentioned, but also the individual circumstance in those countries. But we will continue to monitor, and we do monitor what's going on in other countries and make sure we feed that into what we're doing here. Patrick, I don't know if there's anything else you'd add to that.
No, I think it's very difficult to make those comparisons, and as I say, we'll be able to look and see this in due course. I think there's a lot to learn from other countries in terms of what we need to do, and we're definitely looking very closely at other countries in terms of how they think about release of lockdown measures.
Well, one country that we often quote is Germany. It's another European country with a diverse economy, a big population, and also clusters of high density. The number of deaths there, however, currently stands at just over 3,000. Now, Germany conducted lots of testing and contract tracing from the very outset, and the latest figures show that Germany has now carried out 1.3 million tests in total, compared to that to the UK, which has conducted just 335,000. So here's the UK's Foreign Secretary again.
I know it's difficult when you look at the death toll and those figures, but we are seeing signs of tentative signs of a flattening out, and that was the original plan.
France has extended its lockdown until the 11th of May, but after that, schools will begin to reopen. President Emmanuel Macron has delivered this televised address.
From the 11th of May, schools, nurseries and sixth form schools will start to open, because for me it is a priority, as the inequalities are being more and more brought out. Children who are in poor areas or in the countryside that can't go to school, that don't have access to internet or telecommunication, don't have a complete living this differently. Within this period, inequalities between families are more and more marked. It's why these children need to find a journey to get to school. The government will put in special rules. Time will be organised and space will be organised differently. Children and teachers will be protected with the right equipment.
Well, our correspondent in Paris, Hugh Schofield, was monitoring the president's address.
What I was slightly surprised by was the detail with which he then started sketching out the post-11th of May world. I was kind of expecting him to say 11th of May and then maybe more, but he does seem to be indicating that 11th of May is going to be a key moment at which France begins its process of deconfinement. He said, for example, that from the 11th of May, schools and creches and universities will start to reopen, which is going to be a big change because that'll be 2 months. He said that other sectors of the economy should be allowed to start to reopen. Though at the same time, places where people gather together, like cafes, bars, restaurants, will remain shut. So he's, without getting into great detail, he is sort of indicating to the French that the 11th of May will be a key moment, which is the beginning of a new phase in this whole saga, and that it's not going to be just another date which will be pushed back once again.
Hugh Schofield reporting from Paris. Now, as countries around the world struggle to get the coronavirus outbreak under control, world powers have entered a ruthless competition for medical supplies. Some governments have been accused of medical piracy, basically hijacking shipments of crucial equipment which were intended for elsewhere. Earlier this month, Berlin accused the US of confiscating a shipment of 2 200,000 protective masks. They were being sent to Germany by a US company. Meanwhile, officials in France also accused American buyers of using cash to purchase shipments of masks which were destined for France, paying 3 times the original price. While the UK government denies involvement in all of these incidents, I asked Prashant Yadav, an expert in global health supply chains, why these alleged events are taking place.
While businesses and scientists are collaborating across borders and thinking about how to deliver the best science, governments across the globe are engaging in a zero-sum mentality where they're thinking, if I can get these supplies for my own national needs, for my own national stockpiles, then I will benefit the most. And in doing so, what we are forgetting is that there isn't truly a zero-sum mentality. If we try to get one supplies and block it, we would then not be able to get reciprocity on other supplies that we need. And our end game here is to try and get more supplies, both for populations within the country, but also populations globally, including those who live in low and middle income countries.
And as we see coronavirus affecting, say, certain groups more than others, are we going to see developing countries being affected more by this specific situation, in the fact that they will simply not be able to get the kit, the equipment that they need?
So I think it's worth thinking about separate categories of equipment. So personal protective equipment, which developing countries will start needing, for their preparedness plans, even before infection scenarios become more aggressive. That's an area where I think many developing countries are struggling. And the World Health Organization and other global agencies are helping multiple countries to come together and say, we will try and negotiate these supplies on your behalf. The key question is that even some of the low and middle income countries themselves are engaging in restricting exports. So then it becomes harder for the global agencies to make the case to developed country governments and others that some portion of the supplies need to be reserved and allocated for low and middle income countries. So I think it's a very difficult dynamic.
Italy has become the second country to register more than 20,000 coronavirus deaths after the United States. Another 566 deaths were recorded in the most recent 24-hour period. This figure is just over half as many as 2 weeks ago. And Italy is now gradually lifting its lockdown restrictions and will allow a few companies to resume operations on Tuesday. Meanwhile, in Spain, the Spanish Health Ministry says that 517 people have died in the past 24 hours, which is 100 fewer than the day before. The total number of people to have died from COVID-19 in Spain is 17,500. Some restrictions there have started to relax as well. Well, Damien McGuinness has more on the situation across Europe.
The numbers here are still incredibly high, because in Italy and Spain, which are the two countries worst hit by the coronavirus pandemic here in Europe, we have confirmed cases of more than 150,000 in each country. And in Italy, 20,000 deaths, more or less. In Spain, we're talking about 17,000 deaths. So these are really high numbers. What is causing the beginnings of hope, though, is that the daily death toll is starting to go down. So what that means is that the total numbers are still increasing, but that increase is less than it was just a week or two ago. So when you look at the daily death toll, now we're talking about numbers that are at some points less than 500 per day. Just a week ago, we were over 900 deaths a day. So although the situation is still very severe in both Italy and Spain, it is starting to improve. That's the hope anyway. And that's why governments in both countries are really trying to get the economy going again. Because on the one hand, you have this health emergency. On the other, you have an economic emergency that's brewing, because both countries are in a state of economic lockdown. So what we're seeing in Spain today, as you said earlier, manufacturing and construction workers are going back to work. This is really to get the economy going. At the same time, though, the lockdown itself for most people is still in place. So for most ordinary people, they won't see much of a difference, because you're still not allowed to go out unless it's strictly necessary, and most shops will still be closed. And I think any return to normal is going to take a long time, because it's about getting that balance between getting the economy going while not sparking another outbreak of the pandemic.
Yes, that crucial balance that so many countries are trying to maintain. Now, Russia, also a difficult day. It's reported its biggest daily increase in coronavirus cases so far, 2,500 new infections. The country has declared more than 18,000 cases and 148 people have lost their lives. Now, police checkpoints have been set up on roads around Moscow, and this is to ensure that only residents enter the Russian capital and that they have a valid reason to do so. Meanwhile, China has also stepped up controls around its northeastern border with Russia, which has now emerged as its new front line for coronavirus infections. Well, here's our Moscow correspondent, Steve Rosenberg.
These figures are still relatively low. I mean, in America, you've got, 560,000 confirmed cases compared to Russia's 18,000. But it's important to say that just a few days ago, the Moscow mayor, Sergei Sobyanin, made it clear that the peak in Russia was a long way away. He said that Russia was basically in the foothills of this pandemic. So there is a concern that the situation here is going to get far worse. And already there are reports that the health system in Moscow is feeling the pressure under enormous strain. President Putin's spokesman just a few days ago said the situation in Moscow hospitals was extremely tense. He talked about the heroism of Russian doctors. And interestingly, yesterday, Russian state TV, which normally paints quite a rosy picture of events of the situation in Russia, well, they showed a Russian doctor who said basically his hospital couldn't cope, that they only had 13,000 beds and 1,300 beds and 1,500 patients. So there is a sense here that the situation is getting worse.
Steve Rosenberg with the latest there from Moscow. Well, it's time from Russia to neighbouring Belarus, where despite the warnings, over 1,000 soccer fans attended a football game in Brest. Well, this is the crowd at yesterday's game. And in fact, the Belarusian Premier League is the only place in Europe where football is still being played. And people from around the world have been tuning in to get their football fix. Although there were fans at the game, as we saw, many other fans decided to sensibly stay away. They filled the stands in a much safer way by buying virtual tickets online. In return, well, you can see they get their photos of their faces stuck on dummies sitting inside the stadium, almost as good as the real thing. Now, countries in Asia where COVID-19 first spread more than 3 months ago have taken different approaches to controlling this pandemic. In Singapore, which was successful in keeping cases down at the beginning, 386 new cases have just been confirmed. This is the highest number of cases in a single day so far. We're going to take you to our correspondent in Singapore and also in South Korea and Japan. But first of all, let's go to China, where the outbreak began. Here's Stephen McDonald in Beijing.
China's most strict lockdown has been in Hubei province. However, in most of the country, staying indoors has simply been a suggestion which people have followed. Now it's a cautious road to normality. You need to pass green phone app health clearance to buy train tickets. Neighbourhoods, apartment blocks are still only admitting residents. Restaurants are capping diner numbers. You can't sit too close to others. China is returning to work while guarding against a new wave of infections from citizens returning from overseas.
Here in South Korea, there has been no lockdown, no mandatory restrictions, despite over 10,000 people becoming infected. Instead, the government urged common sense, stay apart where possible, work from home and avoid mass gatherings. And instead of controlling the movement of the population, it has aggressively traced and tested for the virus.
Silent streets and empty offices. Here in Singapore, a partial lockdown has kicked in over the last few days because of a second wave of infections. We're not meant to leave our homes anymore unless it's for one of 12 government-mandated reasons. Break those rules and you face fines, or worse, prison time. These measures are in place till the end of the month, but they could be extended if the virus isn't contained.
Here in Japan, most of us, at least in the biggest cities, are now living under a state of emergency. So what does that mean? Well, it means the government is asking people to stay at home at the weekends and in the evenings. And as you can see, most people are now complying with that. But this is not a lockdown. Offices remain open, so do pubs and restaurants until 8 o'clock in the evening. You can even go and get a haircut if you want to. The Japanese government appears determined to keep the economy going come what may. And Japan is also not carrying out widespread testing. Instead, the government is hoping these limited measures will start to bend the curve of the epidemic downwards in the next 2 weeks or so. Will it work? We're going to have to wait and see. As you've seen from my colleagues around the region, governments here in Asia are using very different strategies to combat the COVID-19 pandemic. But one thing is very striking. Compared to America and Europe, the number of people dying in Asia from the coronavirus appears to be much, much lower. There's lots of speculation why that might be. Is it because people in Asia wear face masks much more? The truth is, right now, we simply don't know.